My name is Verity Bingham and I'm a staff nurse here at Nottingham Children's Hospital. So my pledge for Change Day last year was to make the families of my patients one hot drink, at least one hot drink every shift. For me personally, since Change Day, I went on to win the Roosevelt Scholarship, which saw me go to America for 3 months, October last year to January this year, to research children and young people that have mental health problems and the services that they provide. But I think for my patients with my pledge on the ward, I think it just made a difference in that it showed I had more time to give for my families, and everything seems to be made better with a hot drink. So, you know, when that tired mother's waking up at 6 a.m. and her child's really poorly, it just showed that I had something extra to give really, and I wasn't just there doing busy nursing things. I was somebody she could turn to if need be.
My pledge for last year was to try and encourage all members of the Children's Hospital to take their breaks, particularly the nursing staff on the wards. It had become a culture, really, that it was accepted that you didn't ever have time to take your breaks, that the patients came first and the nurses were putting themselves last. People were getting tired, they were not getting their drinks, not getting their breaks properly. So my pledge was to try and do something about that. So what I did was I developed a board which visibly displayed the times on the day and when the nurses had their breaks. I told them my expectations, which were that they had to have their break, it was important, and that they had to prioritise themselves as well as their patients. And then my senior team and I led from the front really and took our breaks, always early. So we were having our dinner break at 11 o'clock, but that didn't matter because we got our break. We then came out and said, I've had mine, it's your turn, and tried to encourage the team to take over the cares that needed doing whilst they were on their breaks. The reason they weren't going was because they said they had too much to do. We'd shown them that they didn't have too much to do, they had to share the workload, and it was very possible with planning to take their break, not just one at lunchtime. We've now moved on to actually having a break in the evening as well. So it's not ideal 100% all the time. There are still days when it doesn't work, but I would say probably 70–80% of the time the breaks names are on the board, and I can ask staff if they've had their breaks and they'll say, yes, Rachel, I have, yes. So yeah, that was my change.
Change Day, I think it's important because it gives people that little bit of oomph to think outside the box and think, well, actually, what can I change? What can I do differently within the organisation? And it doesn't have to be something huge. It just has to be a hot drink for families on a shift. And I think it really signifies that change starts with me, and you can change one small thing that can have a big effect. And it just gives people an excuse and perhaps a bit of encouragement to go out there and change something for somebody.
The best thing that came out of my pledge was that now staff most of the time take their breaks, which means they are able to function much better. They're happier at work, and that obviously passes on to the patients because the patients don't see these worn out nurses running around the wards. Everybody's happy at work, everyone knows there's a structured approach now to taking breaks, and it's not just on a whim. And I feel quite satisfied that I've achieved something quite big in a very small space of time.